So I would knock on the door and walk in the patient's room, and I would perform hand hygiene. I would introduce myself to the patient. My name is Michaela Kicklider. I'm a student nurse at the USA College of Nursing, and I'm going to be performing your Tube Insertion today. So I would check the orders, and I would see that I'm inserting a Salem sump and connect to low wall suction. I would check my two patient identifiers on the wristband. I would see that I'm performing this on Mr. Jaguar Jones, and the medical record number of 417-6352. 417-6352. I would assess for any allergies and see that he's allergic to penicillin, and that matches his chart, penicillin. So now I would gather my equipment, and I would don my goggles. I would then perform hand hygiene. I would raise the bed to a comfortable working height. I would lower the side rail. I would assess the patient's vital signs. I would check the O2 stat with my pulse oximetry. I'd place it on the patient's finger. I would note any deterioration in any vital signs, and if the O2 stat dropped, I would, any deterioration of vital signs, I would stop the procedure. I would elevate the head of the bed into high Fowler's position. And now with my volunteer patient, I'm going to establish a queuing sign. So if you want me to stop the procedure, I'm going to have you just place one finger up, so that way I know you're feeling discomfort, or you just feel uncomfortable, like you feel like you don't want to go anymore. So next, I would come and I would open my packaging. I would place a dollop of lubricant onto my packaging. I would prepare my tape. So I would have a piece of tape to go on the patient's nose. I would have a long piece of tape to temporarily secure it to the patient's cheek. I would have a short piece of tape to document the time and date, and I would have a dog-eared piece of tape to mark the length of the tubing. So then I would loosen my plunger, and I would perform hand hygiene and put on my clean gloves. I would then assess my patient's nares. I would check the patency of your nares. So I'm going to have you occlude one nostril and breathe in. And I'll occlude the other nostril and breathe in. And so I'm going to choose the left nair on my patient. So then I'm going to clean my patient's nose with either a alcohol swab or soap and water. And then I'm now going to measure the tubing. So I would measure the tubing by going to the patient's from the patient's nose to the patient's ear, and then from the ear to the xiphoid process. Normally I would have the patient remove his shirt to measure it, but for today I won't do that. So now I'm going to use a dog-eared tape to mark the location and the length. And then I will place the towel over the patient's chest, and also place my basin on the patient's abdomen. So now I'm gonna have my volunteer patient go grab the camera to film the rest of this, and I'm going to place the towel and the basin on my simulation patient. So next I would coil my tubing in my hand. And place it into the basin. Then I would take the tubing and lubricate 4 inches of the tubing, and then I would begin to slowly insert the tubing into the patient's nose. So I would have the patient, I would instruct the patient to swallow while I'm inserting it. I would, if the patient was coughing or had a drop in O2 stats, I would have the patient tilt their head backwards towards the pillow, and before I inserted the tubing. And so I would insert the tubing, and if the patient was experiencing any coughing or a drop in O2 stat or any vital signs indicating respiratory distress, I would pull the tubing back into the nasopharynx until the patient was stabilized, and then I would get the patient to swallow before reinserting. So I would also have a cup of water that I would give the patient, and they could swallow a sip of water, or they could dry swallow. So I would insert the tube 1 to 2 inches and slowly rotating to 180 degrees. And I would insert all the way to my marked tape. I would then temporarily secure the tubing to the patient's cheek. And to check correct placement, I would take my syringe, and I could aspirate the contents, or I could assess the pH if needed, or I could get a chest X-ray if ordered. I could also use my pen light and shine it in the back of the patient's throat, and use a tongue blade to push down on the tongue and assess for placement that way as well. So then I would take the suction, and if suction was ordered, I would connect to my suction tubing, and I would place it on low wall intermediate suctioning, and I would cap the pigtail and keep the pigtail above the patient's stomach. I would remove the temporary tape and apply the tape to the patient's nose, and I would loosely tape this, and I would remove my marking tape. And then with a marker, I would mark on the NG tube to show the exit site, so that way I would be able to see if there was any deviation or any movement of the NG tube. I would loosely clip the NG tubing to the patient's gown, so that way they would be able to move their head. I would place the head of the bed no lower than 30 degrees. I would move the side rail back up and put the bed in the lowest position. And I would make sure the call light was in reach, and make sure the patient was comfortable. I would then clean up all my supplies and remove my gloves, glove to glove, and skin to skin, and I would throw them away. And then I would document the type and size of NG tube, the time that it was inserted, the location, whether it was in the left nair or the right nair. I would document how I secured the NG tube. I would document how I verified the placement of the NG tube. I would document if there was any suction applied. I would document how the patient tolerated the procedure. I would document the color, amount, and characteristics of the drainage. And then now I'm going to show you how to properly discontinue an NG tube. So I would check the orders to make sure that that I was supposed to remove the NG tube, And I would explain to the patient that I would be removing the tube. I would perform hand hygiene and put on another pair of clean gloves. I would discontinue suctioning if necessary. I would remove the tape from the patient's nose. I would remove the suctioning. I would kink the tubing back on itself, and then I would slowly but steadily remove the tubing. Before I remove the tubing, I would get the patient to take a deep breath and hold their breath while I remove the tubing. As I remove the tubing, I would just let it fall onto the towel. And I would wrap it up in the towel and throw it away. And then I would measure the drainage. I would perform oral hygiene on the patient, and then I would document the removal of the NG tube.